you for joining the NeedyMeds Overview webinar today. My name is Carla. I am the Education Coordinator here at NeedyMeds, and today I'll spend some time teaching you how to find patient assistance resources on the NeedyMeds website. Before we get started, I'm going to go over a few housekeeping tips. You can feel free to ask questions at any time throughout the webinar by simply typing them into the questions section of your GoToWebinar control panel. I will reserve answering the questions until the end. Please note, if I don't get a chance to answer your questions, I will follow up with you personally via email after the webinar is over. If you experience any technical troubles, meaning you're having difficulty hearing me or seeing my screen, again, send me a message in the same questions section of your GoToWebinar control panel. This video will be recorded and will be uploaded onto our YouTube channel, and I would be happy to send all that are interested a copy of the PowerPoint presentation as well. Of course, I'll provide my contact information at the end should you have any other questions. So let's get started. Who is NeedyMeds? Here's an example of our homepage screenshot. NeedyMeds is a national nonprofit organization founded in 1996, yes, we're 20 years old, by a retired physician, Dr. Sagal, who is our current president. Dr. Sagal discovered through treating his patients patient assistance programs, and he simply wanted every patient and every physician to know about them. So he created a website. NeedyMeds is an informational resource. Through our website and toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses, including, but certainly not limited to, medications. We do not offer direct financial assistance, but rather we refer patients to programs that do. And one of the most popular and effective ways we do that is through our PAPs. So what are PAPs? They are prescription assistance programs that are sponsored by pharmaceutical companies. They offer free or deeply discounted prescription drugs to those that qualify. There is no law requiring pharmaceutical companies to do this. So each program runs their programs differently. Each company runs their programs differently, and not every drug will even offer a PAP. When they do, eligibility requirements and applications will vary from program to program. Some will help uninsured people. Some may help those with insurance but without drug coverage. Still others may help people who have drug coverage but can't afford their co-payments. It varies from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved. This means the patient's doctor needs to both provide the prescription and sign the PAP application. So bear with me while I switch from my PowerPoint presentation to the live website so I can show you how to go about finding help via a PAP. Now, if you're looking for cost assistance with a particular drug, you can simply type in the generic or name brand name where my cursor is blinking in the drug search bar. Or you can choose the Patient's Assistance tab on the navigation bar, which is where we'll spend most of this webinar. Let's say we're looking for assistance with the popular or commonly prescribed medication, Lipitor. We know it's a brand name, so I'll go ahead and choose the brand name hyperlink. And you'll notice when the screen comes up, the first thing you'll see pop up are a bunch of icons. What these icons do is they show you what type of information is available for that drug. And we've actually just added a bunch of new icons in 2016. For example, we added drug videos, which are videos on selected drugs that offer information on prescribing and other important facts about the drugs. Our newest one is we added short drug info, which are 5 key facts you may want to know about certain drugs. You'll also notice on the screen an A to Z index, which you'll find in many of our databases on the website for easy searching. So as we return to our search for Lipitor, I'll choose L in the A to Z index and scroll through the list of medications to see if Lipitor is represented. And you'll notice that it is, and when I click the hyperlink, this indicates that there is further information about Lipitor, and the icon on the left indicates that there is at least one prescription assistance program available. And in this case, there's actually 4 prescription assistance programs available for Lipitor. When you see that there's more than one, keep in mind that the programs that offer the most support will be listed at the top, and the ones that offer the least support, which will be differentiated per the number as well as the name of the sponsoring program, and the ones with the least support will be offered at the bottom. So let's return to the top, which is a PAP offered through a company called RX Outreach Medications. And I hope you'll agree when I say that right now you have a snapshot of what this PAP offers you. Importantly, right at the top, underneath the name of the program, is the contact information. The contact information is really important because you're going to want to be sure to direct all questions about the PAP to the contact information provided, as opposed to NeedyMeds. Next is the application section. Almost all PAPs will offer an active PDF link for their application, which means you can complete it online and print it out for your convenience. Each PAP also lists an eligibility section, and that's exactly what you think it is. It lets you know who is eligible to be a recipient of this PAP. Now, as I mentioned in the beginning, although eligibility does vary from program to program, it is almost always based on 2 things: insurance coverage and income. And because the income requirements are so often based on a certain multiple of the federal poverty level, we put a federal poverty level, or FPL, income calculator right here. So I'm going to click on it so you can see how easy it is to use. Let's say we have a family of 3 with an annual income of $47,500. I'd like to point out the number that you're using here for the income is the same number you would use on your tax forms. So again, we have a family of 3 with an annual income of $47,500. You'll also notice that I refrained from typing in any periods, commas, dollar signs. You'll just go ahead and type in the digits. And it's as easy as that. The results yield that this family's yearly income is 236% of the FPL. When I return to the screenshot of the PAP, you'll notice that in this situation, this family is clearly eligible because they fall below 300% of the FPL indicated in the income requirements. It's as easy as that. But what happens if the calculation shows that the family is not eligible? Let's say they find themselves just above the eligibility requirements at, say, 305 or 310%. Well, when this happens, don't despair. If your income or your patient's income is slightly over the income limit, call the program and ask the program to make an economic hardship exception. They do that all the time. And believe it or not, if the first representative turns you down, we recommend that you call again and re-represent your case. You may find someone with a more sympathetic ear. At that point, you're still denied, then appeal. And finally, let's say if the appeal is not successful or the drug does not offer a PAP, Call the drug company directly and ask them for an economic hardship exception. Again, this is something they do all the time, so it is certainly worth your making a phone call. Do keep in mind that we estimate the application process will take about 2 to 4 weeks from the point of submitting the application to actually receiving the meds. Be sure to keep this time frame in mind so you don't put yourself or your clients or patients in a position of missing their meds. And finally, at the bottom, you'll notice the medication section. This is also important because it lets you know who to send the application to and the details for reapplying. A quick tip for healthcare professionals that are listening in today: don't print a bunch of applications and hold on to them. It may be tempting if you find yourself writing or recommending a specific PAP for a specific medication a number of times. The problem is programs change all the time. They close, new ones open. Sometimes their eligibility requirements change. And even if it's just slightly, you need to know what those changes are. So we actually recommend getting a fresh application off the website each time you apply. Moving on and returning to the Patient Savings tab, I'd like to point out our $4 generic discount drug program database. This is a directory of all of the discount programs for generic meds at major retailers across the country. Those included in this directory usually range in price from $4 to $15 for a 30 or up to a 90-day supply. As you can see, and you'll begin to notice as we proceed through the webinar, there are a number of ways to search for a drug. For purposes of this webinar and to keep things simple and consistent, I'm going to go ahead and use the simple state search by choosing, let's say, the state of Virginia. The results yield that currently in Virginia, there are 18 $4 generic discount drug programs. And again, hopefully you'll agree, there is now a snapshot of those programs on your screen, including the store name and a hyperlink, if one is available, the program name, and most importantly, what the program offers. Now, we have found through feedback from our website users and through feedback from our call center that sometimes people find that PAPs can be complicated. In a response to that, we've put together a directory that lists nonprofits that help people apply to prescription assistance programs. And you'll see we simply called it Help with Prescription Assistance Applications. The places we have listed here are usually free or will assist you for a very small fee. And again, you can search for help in your area by a number of ways, and then programs are listed alphabetically by city. So sticking with the state search, we'll go ahead and choose Florida. Florida has a pretty robust database, including more than 100 locations. And again, you'll find the program name and a hyperlink, and who is helped, meaning who can visit the program to get assistance completing a prescription assistance program. This is one of our relatively new sections of our website, which I think has been up since 2016, early 2016. But keep in mind, we are developing this section, so it is not by any means a comprehensive list. I'm saying that to let you know two things. If you're aware of a program and it's not listed, please let us know. And if there is a geographic location that you feel isn't well represented, let us know that as well. We have a team of researchers working as hard as they can to make these databases as robust as possible for our users. Now, moving on to another very helpful section of our website, the free clinic section. as you can see, which is broken down according to medical and dental clinics. We are so proud that we have gotten this database up to just over 14,000 clinics across the country. And as I said, it's separated by dental and medical clinics, and it does include women's health centers and even locations for STD testing. These clinics are a good example, a good option, for those, let's say, with medical but not dental coverage, for those who find themselves without a primary care physician, and certainly an alternative to an emergency room visit, for those who might visit an ER, not because it is necessarily a medical emergency, like I've had to do and many of us have, but maybe because they feel they have no other option. And again, you can see there are a couple of ways to search for such clinics. But like we did with the other databases, we'll search per state. So let's look in Arizona. The results yield that there are currently 217 free, low-cost, or sliding scale clinics in the state of Arizona. And most of the time when you do a search per state or zip code, it'll yield pretty robust. Yield a pretty robust list. So with that in mind, you can certainly click print all, and it'll do just that. It'll print the entire list of 217 clinics. But you can also narrow down the list further by simply choosing, by clicking the box on the left, the clinics you're interested in, and then choosing the print instead of the print all option. This will generate and print a list including only those you choose. That's a great tool for healthcare professionals that may want to provide their clients with a list, but make sure they're not too overwhelmed. Make sure it's narrowed down enough for their needs. Moving on through the patient savings section, another database that was added in early 2016 is the Radiology Imaging Centers database. I'm not going to spend too much time here. I just want you to be aware that we do have a database that does compare pricing and other important information for various imaging centers throughout the country. Again, you can search via zip narrowly or more broadly via state search. And you'll notice before it lets me search, it'll prompt me to choose a procedure. I want to point out that this Radiology Imaging Center database includes only the 5 most common imaging tests: CAT scans, X-rays, MRIs, mammograms, and ultrasounds. Again, it's a great way to comparably shop before scheduling an appointment, especially for those that don't have insurance, because we have found the fees will change and differ greatly from imaging center to imaging center and from hospital to private facility. Another important and very popular database on our website is a section for coupons and rebates. And this is where you can find prescriptions and over-the-counter medications or supplies for which there is a discount, a free sample, a rebate, or a trial. Just like our other databases, you can search in a couple of ways. You can search by the brand name of the drug, by the less common product name, or by category. And in this case, category means diagnosis. So let's go ahead, just so you can get a sense of what is offered here. I'm going to go ahead and choose a unfortunately commonly diagnosed problem in our country, diabetes. That search reveals that there are currently more than 1,600 coupons, rebates, free samples, or trial offers for diabetes. And that can include anything from medications to testing supplies to monitors to strips. Hopefully, at this point, you're starting to see that the databases on the website are set up similarly to each other. That is purposeful. We want to make the website as easily negotiable as possible so you and your family members or your clients can find what is needed within a few clicks of your mouse. Returning again to the Patient Savings tab, I'd like to take a moment to point out our second most popular and our second highest way to save money are diagnosis-based assistance databases. Now, DBAs provide financial assistance for costs associated with a particular disease. Now, this database is different because for the most part, it excludes medications. What it does include instead are other necessary medical expenses, such as travel expenses to a doctor or specialized facility, supplies, durable medical equipment, testing, wigs, even house cleaning services, copay cards, or assistive technology. And again, you can search by program name, by programs according to state or nationwide, or the most popular by diagnosis. So just so we can get a sense of what this database can offer, I'm going to go ahead and choose cerebral palsy. And you find it, again, I use the A to Z easy index, and then I scroll down until I find the hyperlink for that diagnosis. And there are currently 30 DBAs for CP. And again, this database is organized so that the national programs, meaning you can live anywhere in the country, are listed at the top, and then they're listed alphabetically per state. Now, for specific diagnoses, another great resource is our diagnosis information pages, right in the center of the Patient Savings Navigation tab. And these are exactly what they sound like. They are informational or educational pages for specific diseases, conditions, or diagnosis. Our goal with these diagnosis information pages is to partner with reputable organizations. So that usually means either nonprofit or governmentally funded organizations to provide the most comprehensive, up-to-date, and accurate information about a particular disease. For example, let's go ahead and choose lung cancer. As you can see, for the lung cancer diagnosis information page, we sponsored with a nonprofit called Longevity, and they make sure that the information and the text that you find is accurate. They partner with us to provide accurate and what we feel are pretty important links or resources on the right-hand side. And what really differs the NeedyMeds diagnosis information pages apart from other educational pages found on the internet is that we keep a current list of medications commonly used in the treatment of that diagnosis. And you'll notice each of those drugs is hyperlinked. And that's because these pages are set up so that all you have to do is click your mouse and the website will search to see whether or not there are any cost savings programs available for that drug, including PAPs, DBAs, coupons, rebates, discounts, free samples, anything that will offer some financial support. Now, for those of you that find yourselves working with the senior population, on the right-hand side, you're going to want to keep in mind our government program section. As you can see on your screen, this includes state-sponsored programs such as PACE, which you may already be aware are a program of all-inclusive care for the elderly. We have a pretty exhaustive Medicare information, as well as all of the Medicaid sites available. We also have all of the SHIP sites available. We certainly recommend, again, if you are a senior or if you find yourself working with the senior population, reach out to the volunteers in your area through SHIP. They are chock full of helpful information. We're proud of our relationship with ShipSites. And because when we're talking about the federal government, a lot of applications and questionnaires require income and tax details, we included a convenient link so that you or your clients can calculate the federal poverty guidelines and even print out a tax return form, which again is very often required. Now, if you bear with me while I escape out of the live website and transition to our PowerPoint presentation, I'd like to talk to you about another really popular way of saving money, which is through the NeedyMeds drug discount card. With our card, users can save between 0 and up to 80% off the cash price of prescriptions, over-the-counter medications or supplies, as long as they're written as prescriptions, and even pet prescriptions if they're picked up at the People Pharmacy. Not every product is discounted, and our drug discount only works for brick and mortar pharmacies. It doesn't work online. Proud to let you know that last month it saved consumers nearly $4 million, and our card is used about 85% of the time it is presented to the pharmacist. So how does it work? Pharmacies negotiate discounted prices with an adjudicator. Discounts change frequently. They vary from month to month and from program to program. So we recommend trying the card each time you or your patient makes a purchase. There are no eligibility requirements. There's no registration, no activation, and no application. And I'm sure you're aware that there are many drug discount cards available out there. So what's different about the NeedyMeds card? First, it's completely free to obtain and use. Second, we do not collect any identifiable information about users. It's totally anonymous. So you're assured that we can't sell or share your information to third party or marketers. We only track the dollar amount of savings and the number of times the card is used. And third, although we do earn a small transaction fee each time the card is used, we don't try to maximize our own profit. Our goal is to pass the most savings on to the user. Our card never expires, and it can be shared with family members or friends. You simply bring your card and valid prescription to the pharmacy. At this point, it is accepted at more than 65,000 pharmacies nationwide, including all of the major and local chains. If you ever have trouble using the card, or if a pharmacist is not familiar with the card, simply call the number on the back. So who can use the card? Anyone. The only rule is that it cannot be combined with insurance. So if you're uninsured, you can use the card anytime. If you are insured, you can use the drug discount card instead. And you may be wondering, if you have insurance, why would you turn to a drug discount card? Well, there's actually a number of reasons. You may find, although you have insurance, your medication is not covered. You may find the co-payments are too high. Maybe the deductibles are too high. You may find yourself in a coverage gap, like the Medicare Part D donut hole, or maybe you've simply exceeded a cap for drug coverage for the year. Now, here's a slide that lets you know that there are a number of ways to get your free drug discount card. You can get it through our website. You can mail us a request to our P.O. box. You can call one of our expert counselors on our 800 number. Or if you're looking for a bulk supply of drug discount cards, you can shoot an email to my colleague, Alana. I'm going to go through one more slide to show you how to maximize savings for your drug discount card, and then we'll go ahead and switch back to the live site so I can show you everything I'm going over and how to actually find it. In addition to show you where to find the drug discount card and how to request them on the website, I'll point out to you a few other handy tools, including our drug pricing calculator, which has been recently updated and simplified, a pharmacy finder, and some other apps that we think you'll find helpful. So on the NeedyMeds website, there's a number of places to request the drug discount card. You can click on the Patient Savings tab. And as you saw before, excuse me, I have a little bit of difficulty with my internet connection, but when you do click on the Patient Savings tab, you'll find a couple of links for the drug discount card on the left-hand side under the Prescription Assistance box, or in the bottom right-hand side under the Additional Resources box. You'll also see the box on the left, and all of these hyperlinks take you to this page, where you can click on and print out a downloadable PDF. You can fill in the form here, being sure to request a particular design. You can mail us a self-addressed stamped envelope to our P.O. box, or at any time, you can request it through one of our counselors at our 800 number. Now, just returning to the drug discount card page, if you scroll to the bottom, you'll notice that there's a pharmacy search. The pharmacy search is great. It's exactly what you think it does. It lets you find a pharmacy in your area, and I'm going to do a search for right in my own backyard. And let's say I have access to public transportation or a car, so I click that I can get 20 miles away. And it will let you know the pharmacies in your immediate area that are already guaranteed to accept the NeedyMeds drug discount card. And not only can you find what pharmacy accepts the card before you venture outside, but you can also use the drug pricing calculator on the left to let you know how much your medication will be using the NeedyMeds drug discount card. As I said, we've simplified this drug pricing tool. Keep in mind when you use it, in addition to knowing the zip code where you'll be picking up your meds, you're also going to need to know the name of the medication, the dosage, and the amount, meaning is it for 30, 60, or 90-day supply. On the left-hand side, we also have a couple of helpful apps, including, of course, the NeedyMeds drug discount card app, which you can download right to your phone, as well as a medication reminder that helps you to not miss important medications throughout the day. And while we're on the left-hand side, I want to take just a quick moment to point out HealFunder. HealFunder is actually not a database. Instead, it's a crowdfunding platform. Maybe you've heard of Kickstarter or Indiegogo, except HealFunder was created by NeedyMeds, and it's used to specifically raise money for medical bills. Patients can fundraise to pay for medical bills already incurred or something they are saving for in the future. And of course, organizations can use this for their fundraisers as well. HealFunder is unique and differs from other crowdfunding platforms by two important ways. First of all, we verify the diagnosis, by which we mean we require documentation from the treating physician. And we also pay the medical bills directly, so you can be assured that your money is going where it was promised. While we're still on the live website, I'd like to point out a couple of other resources for advocates or healthcare professionals, or people just interested in staying up to date on healthcare topics and what's going on at NeedyMeds. I certainly recommend everyone sign up for our patient assistance newsletter. We're going to be emailing out every month, instead of every other month, a quick newsletter, again, about healthcare topics or what's going on at NeedyMeds. We're changing the formatting to, although we're sending it out more frequently, we're working on it being shorter, more direct, and also a lot more mobile friendly. So please be sure to sign up. We also certainly recommend that you take our Patient Assistance Resource Education course and exam. PAIR, as we call it, is a self-paced online tutorial which teaches healthcare workers how to find assistance for their patients It's a professional development tool for which we normally charge $15. But for anybody that's participating in today's webinar, we're happy to waive that $15 fee. You'll be able to take the class and we'll provide you with a certificate of completion. Now I'd like to transfer back to our PowerPoint presentation so I can point out just a few other tools that you may find useful. For those of you that work in the healthcare profession and find yourselves manually handwriting prescription assistance program applications, we recommend you're looking into a software to eliminate that administrative burden of handwriting applications and manually tracking orders. We created PAP Tracker software, and you can purchase and have a trial of that through NeedyMeds. But even if you don't use PAP Tracker, we suggest you look into some sort of software to help you with that administrative burden. Again, if you're a healthcare professional, you work for a healthcare organization or another organization, we're happy to partner with you by creating, for example, customized drug discount cards, which means that in addition to or instead of the NeedyMeds logo, it can have your business's name or logo. We're always happy to partner with other diagnosis-related nonprofits to create diagnosis information pages. We're happy to help you create a prescription assistance program. And of course, we can cross-post with each other on our websites and social media outlets. If you're passionate about helping people in your community afford healthcare and spreading the word about NeedyMeds, please let me know. We're happy to have you on board as an ambassador, where we'll train you to promote and represent NeedyMeds in your own backyard. One of the things we're proud of, and I figured I'd mention it, we just added the ability for people to text us a donation. So if you're feeling so inspired, you can simply text NeedyMeds to 91999. If you do have questions, you can contact me directly. And if you're looking to order drug discount cards, brochures, or any other informational or educational material, you can contact my colleague, Alana. And please do keep that 800 number available to you. Our experts are here 9 to 5, Monday through Friday, Eastern Standard Time, to help you out. So now I'm going to take a moment to pause and open up the webinar for any questions. Oh, here's a really important one. I just mentioned that if you have participated in today's webinar, that I'm happy to waive the $15 fee for the PAIR course and exam. No, you don't have to have any code. You just simply send me an email or send at carla@needymeds.org or my colleague Alana an email at alana@needymeds.org and let us remind me or let Alana know that I said I'd waive the fee, which I'll also let her know after this webinar. And just shoot us an email, and we're happy to send you the links to take that patient assistance resource education course and exam for free. I'm not seeing any other questions come in, but keep in mind, as I said, if you do have questions, you can feel free to email me at carla@needymeds.org. And if you're specifically looking for assistance to find cost savings healthcare options, please call our helpline at 1-800-503-6897. As I said, a copy of this webinar will be up on our YouTube page probably by the end of the week. And I will also follow up by sending you a PowerPoint PDF of the material that was covered today. For now, thank you so much for your time. I know it's a busy day and we appreciate your taking time out of it to learn about NeedyMeds. We do hope you keep in touch. Thanks again for your time and have a wonderful afternoon.